What is going on, gangers? Brother Nandi back at your service, and I'm here to dive into a continuing series where we look at fictional characters and what health conditions they may have. If you'd like to stay caught up with this series, please make sure you subscribe to my channel. For part 14 of this series, we are going to dive into a fictional character that people may or may not know, and his name is Naruto from the Naruto Shippuden series. I decided to use ADHD to describe Naruto's condition. Let's first dive into what ADHD actually is. ADHD stands for Attention Deficit Hyperactivity Disorder. It is basically a mental health disorder that includes attention difficulty, hyperactivity, and impulsiveness. The causes are unknown specifically, but genetics does play a big role. If a sibling has ADHD, there's a high probability that you will have ADHD as well. ADHD is linked with having low dopamine and norepinephrine levels, and those are basically transmitters in the brain. Well, clearly Naruto has no siblings, guys. He was an only child, so there's nothing there to link with him. For symptoms of ADHD, we have to base it based on categories: inattentiveness and or hyperactivity/impulsiveness. But it's very common that an individual can have both of them. For inattentiveness, one can showcase difficulty focusing, not following instructions, making mistakes, not completing tasks, or even forgetfulness. For hyperactivity and impulsiveness, one could not stay still, be impatient, and continue to interrupt others. Other symptoms would include tantrums or just getting frustrated doing activities. I do want to point out, as one gets older, symptoms tend to showcase less. In Naruto's case, he struggled in the Ninja Academy. He lacked focus. He spoke and interrupted others repeatedly. He often found himself falling asleep in class. Y'all remember when Naruto did the sexy jutsu for the first time? He did not follow the instructions of his teacher in the transformation jutsu. All these things can highlight why Naruto would have ADHD. ADHD can also lead to anxiety, depression, learning disabilities, and sleep disorders. And in adults, it can lead to lack of finding a sustainable job and substance abuse even. How do we diagnose ADHD? First off, one needs to be diagnosed between the ages of 6 to 12. You need 6 of the 9 symptoms of inattentiveness, hyperactivity, or impulsiveness for at least 6 months. You could also give a documentation called the Vanderbilt Assessment Scale to assess their symptoms in a score-like fashion. You could get diagnosed with ADHD as a teen or adult, but it will be more extensive. For treatment purposes of ADHD, we are going to do family therapy, teacher and parent involvement as well. Because when all parties are involved, this gives the best care for the child or even the adult. CBT can be included as well. But for medication, we are going to use stimulants which increase someone's neurotransmitters, specifically dopamine. For example, methylphenidate and amphetamines, which is commonly known as Adderall, guys. I know some of y'all know about that. But things to watch out for when you're taking stimulants. ADHD medication can increase your heart rate, it can cause insomnia, and it also can cause decreased appetite. So we want to make sure to give the meds after you eat. In Naruto's case, Adderall definitely would have helped him, and there's no ifs, ands, or buts about it. As always, if you have any of these conditions, please seek help because you matter at the end of the day. Fictional characters were used to give a different perspective to these situations. If you appreciate this video, please like, comment, and subscribe. If you haven't already, please check out the previous 13 parts to this series. And if nothing else, y'all take it easy.